Welcome to another episode of the Aligned and Elevated podcast. I'm your host, Dr. Allison Feldt, owner of Body Motion Physical Therapy, owner of AF Wellness Community, and your host of the podcast, like I already said. So today is a special episode. So we are bringing on my ride or die. This person is beyond special to me. Devyn was my first hire that I ever made in the body motion evolution, really. You were, I think in Body Motion started July 2017. So after July 2017, I went and started this Body Motion, and it was a mobile business. Then we went on and started to hire employees, aka I went on and started to hire employees, and I started interviewing in December 2018. I hired you. This is December 2018. And you started January 1st, 2019. So, very first employee, she was hired as like the clinical, or was the client.
Part-time front desk assistant.
Yeah, part-time front desk. And she did marketing, she did sales, she ended up doing it all. And now she's the general manager of both locations and oversees the marketing department. So, she is extremely special to me. She's been with me from the very beginning. And today she's on the podcast, gracing us with her presence and allowing us to dive into questions about me and the business and everything. So she wanted to interview me. She thought that would be a fun episode. Dr. Katrina also wants to interview me. And so here you have it, our episode where I take the non-host role. Devyn takes over, and we're going to go from there.
Yeah. Welcome to another episode of Aligned and Elevated. I'm your host today, Devyn. And to start us off, I would love to kind of hear, if you weren't a PT, what would you want to be doing?
Oh, that's so good.
Yeah.
Okay, two things. I've always wanted to be a barista, so I would love to make coffees, and really in this era, I could see myself owning different coffee shops. But I think as my side gig, if you were what would you go pursue? Or maybe what are you going to pursue next in your dream fantasy world? Okay, let me tell you about it. So my dream fantasy world is that I go buy plots of land and get investors to build hockey rink resorts. And what this looks like is big hotels with multiple hockey rinks inside of it, where the hockey is for the community and people can skate there, learn to play. Obviously you'll always have figure skaters too, but it's a community ice centers that are located all over, and then we build massive resorts. So I grew up playing hockey, and I always dreamed, with my mom actually, of having these hockey rink hotels where the hockey rink would just be located in the bottom of the hotel. And as I've gotten older and gotten a tad bit bougier, these would be spa-like resort hotels where kids could go and have areas where they play floor hockey when their teams come to play and have tournaments at the rink. And then we would have a youth hockey association, and then of course an adult hockey association. And so hockey rink resort hotels are I think that's maybe my next adventure / my dream life.
Yeah. I would have never guessed that. And I would have never guessed the barista. In my head, I was she wants to be a pro hockey player, obviously. So because you don't currently have the legacy of these luxury hockey hotels, what do you want your legacy to be? I know so much of it is women's health related, but when you lay your head at night, you're I want to be known for this.
That's so interesting. I guess I never really think that way. I don't think about, I guess I'm not pursuing anything for my own personal legacy, because once you're fucking dead, what does it matter at the end, I guess?
Love it. Love a real answer.
But I think if you ask me what my mission is, my purpose, it's absolutely women's health, changing women's health care. But it was always I want women to feel really good. I don't want them to have pelvic issues. I want them to not have to go down the rabbit hole of chasing low back pain. I don't want them to have to go down the rabbit hole of chasing hip pain, which is all related to the core, which then drives them on into cortisone injections and surgeries. And obviously there's a time and a place for surgeries, but if you follow along at all, you know that this is absolutely preventable. And so that is my life mission. When the pelvic floor is strong and healthy and the core is strong and healthy, we feel really good in our skins.
Multiple.
But that, it unlocks something deeper, right? It unlocks when I was still in the treatment room, I remember I'd come out to you and you were in the front and I'd be like, she just told me, she's in marketing and she just told me that she wants to pivot and go open her own business, and she wants her business to be fitness related for postpartum moms, or she wants her business to be a doula agency because she was so impacted by like this journey. And I think so many moms get impacted by their journeys of going through pregnancy, going through postpartum, that they then want to pivot and make that career switch. And what I see is that a lot of moms like it when they're in that phase, but then it kind of fades out and wanes away and they don't really stay with it as life gets busy. And so I would love to see that shift. I would love to see like the continued pursuit of their passions and their creativity. And so I really think like my mission now is like, yes, every creative mission, every creative pursuit, every contribution and service that I bring to this world, that every woman brings into this world, it starts with their pelvic floor physical therapy. It starts with their health. It starts with their internal health. It starts with the health of how they move their body, which is how they feel in their skin, which leads to confidence, which leads them down a path of finding their own creativity, which allows them to generate their passions and pursue their passions. And at certain points, I think along that journey, we get distracted, whether that's 10 years with the kids or 20 years with the kids at home. And we can lose ourselves. And the minute that the health ticker goes out the window, the minute that you stop caring about the health aspect of it, everything goes to shit. Everything.
We see it all the time.
Yeah, you actually could start shitting yourself. But no, but like really, and we help with that, right? That's why I say that. Like if you have bowel incontinence, like we will help you with that. But that was a tangent. When your health is not your priority, and when we lose our health, we lose every single thing that our health brings us, which is how we show up for our family, which is how we feel about ourselves, which is how we show up to our jobs, which is how we show up to life. And if we're not showing up because we feel like shit because our health is bad, then we don't get that creativity, that spark. It's really hard to sit and feel like shit and then be like, oh yeah, I'm going to go jump on creating this business to help go improve society. Yeah. It just doesn't happen. So, I think one of the things, you talk about, I don't even know what your original question was, but you talk about like the mission of the business. It is 100% health, but it's because health is wealth. Like health drives your income, health drives your contributions to this world, health drives everything. It is the nest egg, and pelvic health especially like is the root of all of our of our total body health. And so what we have at Body Motion is we see a lot of patients monthly, right? So we have clients that come in on this monthly basis, and it is such an important tune-up. Like you might get a massage once a month. If you don't, you should. But you absolutely should get a pelvic health tune-up. And we tune up the whole body. If your neck is sore, we're working on the neck. But we're also making sure your pelvic floor is dynamic. You have range of motion, that your core is super strong. This is a 50-minute hands-on session to make sure all your muscles, all your joints have the range of motion, have the strength, have the stability, so you can go dominate life. And then you're not going to be chasing this achy hip, which is eventually going to lead you down, to a hip replacement. Not anytime soon, but like right down the line. And so the more that we keep the body tuned up, the more that we just keep investing in our health and keep our bodies healthy, it just unleashes everything that women contribute to this world, and that will make the world a better place. And so I think it's like not just, I started the mission of being like, live for your health, live to avoid diapers, live to avoid, being in a wheelchair eventually. And the truth is, it's like, along the way, if we're not caring for our health, we just can't improve the world, and we can't progress this place to be a better place. And I think we're all put on this planet for, this is getting deep now, but I really do believe like we all come to life with some kind of mission, and we have to unlock our own potential and figure out what lights us up, where are our true gifts, and how can we move this place to be a better place. And we can only tap into that when we feel good. So, drawn out story, but
we love a rant.
That's where we're at. That's
yeah. I love that. And what would you say is like the moment in time that unlocked your potential, like that you knew like, oh, I have to level up, or like I'm meant for more?
Yeah, so as a physical therapist, I think there's been multiple signs, right? And I think gut intuitions that I just followed. When I became a pelvic floor physical therapist, I didn't want to be a pelvic floor physical therapist. I didn't really like touching people in general. So then to think that I'm going to go touch people's bodies and all this stuff, it was like, that was not that fun to think about. But we had this woman come into our PT school, and she eventually became my mentor and was hugely inspirational for me. But she comes into our PT school, gives the one lecture on pelvic floor health, really. So it says like women can leak, and oh, by the way, if you were leaking as a female athlete as a kid, like that's, this is really common stuff, and here's why this happens. And it was like, and that was me. So I was like, fuck, I don't want to know that, but like that's kind of nice to know that there wasn't something wrong with me. But it's just not something that like you talk about often. And so the minute she started saying that, I think that was the first clue to be like, shit, I actually have to pursue this. Like, this is probably a little bit of my calling. And I didn't want it to be, because I wanted to be a sports physical therapist through and through. I was a hockey player. I wanted to work with hockey players. I wanted to have a hockey training facility. Like, that was going to be my jam. But then I was like, that was my first sign. And then the second sign was like being at a clinical when I was in PT school, and realizing like, holy cow, like the way that we're changing people's lives is truly instrumental, and I've never seen this done in physical therapy before, even though I had worked at a PT clinic before I went to PT school. And so then I think the real like final ticker for me, I had already become a pelvic floor physical therapist, had worked in nursing homes, worked in outpatient physical therapy, and I started to put together these patterns that women were experiencing. When I started to, when I was like, okay, how come everyone past 65, or getting home health services, like in their 70s and 80s, how come they're all wearing diapers? How come they can barely walk? It's every freaking one of them. But then especially the women, why are all the women getting joint replacements? And they've already maybe had a bladder surgery and they're still in a damn diaper. And it was like, what did we miss along the way? And so when I started to really thread these patterns together, which you can read all about in Restore Your Body After Kids, The Secret to Avoid Peeing Your Pants and Achy Joints as You Age, that book, that's where I really break down the patterns that happen for women, the soliloquies that happen when you don't have your core. Yeah, I talk about it in a framework that's for after kids, but the reality is, like, kids or no kids, if your pelvic floor isn't working for you, which can happen without kids, then you don't have your core. So you're going to fit the pattern. You are going to fit these patterns and these different soliloquies that happen after kids. Yeah. And so if you don't heal your bodies and we can't, help progress people, then of course they have to turn to surgeons. Of course they have to turn to, pills and injections. And then that just is a cover-up, right? Because then you're not actually changing the body. You're just putting a Band-Aid on it. Yeah. And that sucks. That really, really sucks. There's a time and a place for everything, for every surgery, for every Band-Aid, for every injection. I've definitely recommended it at certain points to different patients. But if you are also treating what has caused that in the first place, then you're eternally fucked. And it's just going to go somewhere else and ruin some other joint. And so I think that is, when I put all that together, that is when I got my aha moment of like, this is what I'm meant to do. I put it all in a postpartum, in that book. And it was the hardest effing thing for me to release because it was putting myself on the line. And I think one of my biggest things I had to get over was the judgment I was going to face from other people, especially other pelvic floor PTs. Because these were just patterns I had seen clinically. So were they even fucking valid? I don't know. I didn't know. I didn't have the confidence back then that I do now. I've seen it for the past 15 years now. So, like, yes, very valid. Yeah. But it was like there was this little person on my shoulder that's like, this is not an evidence-based randomized controlled trial. Like, okay, go fuck yourself. Like, this is all very valid, right? Like, this is all, it doesn't need to be research-based. This can be what we see in the clinic. This can be what I see time and time and time again. And at a certain point, you get angry about it. Like, I definitely had my moments of anger, and then seeing my mom go through what she's gone through, it's like, it makes you angry at a certain point that, like, how come no one stepped out of the box to be like, this isn't right, this isn't normal. Every physical therapist has just gone on and been like, oh yeah, actually, we see that pattern too, but insurance, we can only treat your knee. And, oh, you want to prevent something? No, we don't do that, you know? And so you're so boxed up and confined as a healthcare provider, with rules, regulations, and all that stuff. And it just, there's a huge missing link. And I think once I like gained the confidence to speak the truth and speak what we see, I can't stop.
Yeah, totally. I love it. And I've gotten to see it firsthand. It's amazing. So I guess my next question would be like, when was the moment that you knew you were playing small? Like, that you knew, like, oh, this is going to get big. Like...
Do you think it's big now?
Yeah.
I mean, I still feel like I'm playing small.
Yeah.
I honestly do. I feel like there's so much room to grow this. I feel embarrassed that it's still small. Like that's how I feel. I don't actually feel like this is big.
Yeah.
In the fact that there's so many people that still don't even know what we do. Like, maybe they've had pelvic floor physical therapy and it's consisted of the Kegels and it's consisted of, like, you know, doing some core strengthening, and it's like, okay, great, but, like, really, like, is your core optimal? Are you optimally functioning in this world? Like, are you not leaking? Your bowel movements are fantastic? Are you having really great sex? Are you having, like, any pain in your knees or your hips and your neck and your mid back? And most people do, to some degree, have some issues, and so it's like, there is still room to improve, and I think what people don't realize is, like, every shoulder problem is a pelvic floor problem. Every knee problem is a pelvic floor problem. And, like, everything is so interconnected that just dealing with one area doesn't do the body justice. And I'll just tell you, this weekend I was sitting with some moms, and I still play small, and I'm still working on using my voice. I know you're laughing, like you think I play big, but I feel like I'm just still so small. Like, I'm like, why isn't this on the Today Show every damn day until every single woman feels empowered to go live their best lives, right? Like, it's truly...
Today Show, we are ready for you.
Yes. But, where was I going with that? What I want to say, though, is like I was even with a bunch of soccer moms this weekend. Chloe had a soccer tournament, and I've been with these moms now for like a year and a half, and I'm kind of shy outside of our work environment. Like, I'm very introverted outside of work. I know you're like, you don't think that's real, but it is very much real. Like, I keep to myself. I really don't always put myself in social situations. You're not going to find me at the bar. Like, it's just not where I'm going to be. But, so the moms were asking, like, oh, what do you do? And we were talking, and it was nice to communicate with them. And I wanted to talk to them, like, wanted to know what they do or what their husbands do or whatever. And one of the moms, and I told them, I was like, you know, I have these businesses and also do this podcast. And one of the moms was like, oh, you have a podcast, you know? And I was like, it was so flattering, but I was like, fuck, like, how do I not have more word spread on this, you know? And, like, and that's how I feel about pelvic health and, like, everything related to women's health at all. It's like, people just don't know what they don't know. And so there is still such an effort to get this done. And I have to just say one more story. Like, I was working with a client last week. It was a really complicated case. Just happened to pass her in the hallway, and she, like, kind of, you know, went through her, like, just, like, caught me up on where she's been since I chatted with her last. And she was like, you know, I just can't believe I could have prevented all of this if I just knew that I needed to come here during pregnancy. And that literally breaks my heart. And that makes me, every freaking day, be like, you're not playing big enough. There's so much room.
You believe that you can have a bigger impact, which I absolutely love. Is there, like, a belief that you had previously that you had to let go of to get to this point?
Yes. And it's actually a very scary belief to even, like, acknowledge publicly. But, like, I didn't want people to know who I was. I didn't want, like, you know, you're always worried, like, oh, is someone from the past that, like, maybe I hurt their feelings, or, you know, you just, I think it's really hard to get past what people think. Because, and at the end of the day, you can do as much fucking self-work as you want, but I think if you just say, oh, I don't care what anyone thinks, I'm moving on, I'm moving past this, I'm doing what I want to do, I'm preaching what I want to preach, I'm spreading the word, I'm doing this, there is an impact. Like, as much as I can say, like, all the DMs and the haters we get, like, don't impact me, like, they do. Like, there is a piece of it that's like, oh, you don't want to give attention to the negativity or give attention to, your past demons, but it's there, and of course, hopefully you work on working through your past demons, that can hold you back a little bit. But I think at any point in time, you can let the hate shut you down or quote unquote cancel you and tell you that you're not, being compassionate or you're at, whatever. But if you let that hold you back, then you're doing a disservice to the thousands of people's whose lives you can help impact and help change. So I think that's a big thing I had to get over. Like, what would people think of me? What would people think that I went to high school with or elementary school? It's like, Allison, why does it fucking matter? Who cares? Like, it just does, that stuff doesn't matter. But those were beliefs that I definitely had to get over. Also had to get over the fact that, making money was bad. I wanted to give this away for free to everybody. But man, we've done that. I mean, you and I, we've given sessions away to people, we've given packages away to people. And what you realize is, when you put your own investment forward, you get better. When you don't, you don't. I mean, there's no softer way to say it, I think. And also, you just can't grow a business when you're giving it away. And it sucks. Like, I wish this could be Mother Teresa's clinic and, like, we could just help everyone that can't afford it, right? But at the end of the day, if you want to make an impact, you actually have to charge money so you can hire really top-notch, top-level people that are going to do your protocols and expand the mission and grow on them, grow themselves. And like, if you want top-level healers and people that are going to help women unlock their potential and, be the executors of this mission, then you have to pay them because they can't do it for free either. And I think that was something I had to get over because money was kind of looked at as like a selfish bad thing. But then I had to pay for daycare, and I was the one that had to pay for the daycare. So, and my student loans. And so you just learn real quick that you have to charge for it. And, but when people pay, they get better. And when people come here, that they pay out of pocket. They might take a loan out, they might put it on a credit card, but when they get better and they sign up and pay for it, they're gonna get better no matter what. Because they're gonna freaking make it work for them. Because they've made the decision that they're gonna get better. And once you make that decision, there's nothing that's gonna stop you.
So I feel like that question really highlighted the fact that you have like an awareness that a lot of other business owners may not have. And so I personally know that you go through a lot of coaching and you've had, therapists and mentors and a spiritual baby medium. So how do you like intertwine all of that to first be a good leader and also like to make decisions like for your business?
Well, thank you. That's so nice to say that I'm a good leader.
You are.
I love you. Yeah, I couldn't do this without business coaching. I didn't go to PT school to learn how to be a business owner, right? So I had to learn how to run a business real fast. And so I invested in business coaching right away, even when I only had $5,000 to my name. Like, I was like, this is probably what I need. I need to learn as much as humanly possible. Getting myself around the right people has been probably one of the best value adds to my life because I get to see, their mistakes and their successes and because I started from the very beginning of my business, I have gotten to follow really successful people. And I think that's in anything you want to do well in your life, go ride the coattails and the wins of the people that have already created the path, right? And so I just got to learn from people who have been doing it and had done it with also living the lifestyle and the freedom and everything that I wanted to also do. And, you know, because you can go run a business and make a lot of money and be miserable as shit and working, you know, 20 hours a day. And granted, there was a phase of my life where I was, but I wanted to have balance. Like, I wanted to be there for my kids. My biggest goal in the beginning was, like, I wanted to be able to drop them off the bus and be home for them at the bus and take summers off with them. Now those goals shifted massively once I had them, you know, once we got into older phases, and I realized, like, morning was my prime time working, and that's where I wanted to spend my mornings. But, you know, it continues to ebb and flow and shift, right? And so the business coaching for me is just other outlooks. You only know what's in your own head. You only know what you consume from books. Most of the thoughts in our heads aren't actually our own thoughts, right? Like, it is from the world, and that's how we develop our own opinions and our own thoughts, our own feelings. And so you just want to be really careful what resources you're getting those thoughts from. And I'm lucky that I've, you know, gotten in with some great business coaches and sit around really intelligent people. And I think that's part of my mindset, though. It's like I always want to be growing. I always want to be learning. I don't feel like I'm a good enough leader. Like, I could be so much better in every single department, every single facet of my life. And so I don't think I'll ever have a contentment around that. But then I also know that, like, my pursuit to be a better leader, my pursuit to run this business bigger and be bigger and make a bigger impact, is the fulfillment is in that pursuit for me. And I think that's one of the biggest lessons I've learned. It's like, because I remember asking myself along the way, like, Allison, when is it ever going to be enough? When is this going to be enough? And, like, and so I almost felt like, how are you not happy with yourself? How are you not, like, and then I realized, like, no, the fulfillment, the joy, it's not about the bank account. It is 100% the journey. Like, and I know everyone says that, and it sounds so cliche, but that's the real truth, right? It's like, you just get your fulfillment, you get your happiness by continuing to pursue this. I mean, today we got to go do this photo shoot, right? That's why I have my hair done and my makeup done. And Devyn curates the photos, and, you know, we get to use this content for the podcast. We use the content for the social media. We use the content for different branding and office things. And it's like, I get to go do that. And, like, I think both of us we end the photo shoot and we're like, that was so fun. And then they even said during the photo shoot, I can't believe you guys have to go back to work to do this. And I was like, dude, we get to go back to work. Like, you don't understand our work environment. Like, you don't understand that, like, this is where we find, or where I find, I won't speak for Devyn, but where I find, like, so much joy. Mm-hmm. We both will say, like, if we're having an off day, it's like, we'll come into the office the minute we're here and we're working, and we're like, thank goodness we came in today. That was the right decision, because I feel so much better. Yeah. And I think that's just the energy of what the office is, and a lot of people are responsible for that feeling inside. Everyone has to show up, right, to be able to bring each other up. And so that's where I'm like, we have such a great team, we have such great culture, and I don't even feel like I can take credit for that, but maybe a little bit. Maybe, you know, maybe a lot bit. Of it. It's funny, like, I am super grateful for it. Like, to be, like, there's not many people in this world that can be like, I'm going to go to work and I'm going to come home feeling that much better, right? And it's also in the nature of what we do. Like, helping women feel the best in their bodies and freaking thrive and go doing epic things. Like sailing the damn world when they couldn't even hold down a job because they were in so much pain. And, like, when you see people live these lives and, like, you impacted it, or, like, they went through endless fertility treatments, but then all of a sudden they're knocked up after doing our fertility protocols for 2 months, you're like, I mean, this shit works. And that fills you up to the nines. Every single birth we get a picture of the baby. Yeah. Like, you know why you're doing it, right? And so, like, I mean, it's not just the energy and the people and the culture. It's also, like, the effect that we're having on other people's lives and how we get to touch other people's lives. It's, like, really special, and I will never take that for granted.
And, like, to have seen you through your personal growth journey, and, like, you have always had this, like, intense self-belief and very, like, positive outlook. And I think you do need to take a big portion of the credit for our culture, because, like, you instilled it in me, and then we kept bringing more and more people on that had that, like, light reflection of you in them. And so it's like, now we get to this point where it's like, we love our team, and we hear that again and again from them, and then we hear it from the clients too, that they're like, oh, I just love being here, like all of our reviews are like the team, and it's like it all started with her. So take your credit, take your flowers, it's all you. So you had mentioned that you really wanted to be able to pick up those kids, drop them off, all that stuff. Like, what life lesson have they taught you that you can bring into either the treatment room or the office, or just like your outlook in business in general?
Yeah, I mean, I think the children just gave me a sense of presence. And I didn't learn that lesson, unfortunately, until Jayla was born. I think along the way of like curating Jayla's incarnation, when we were, you know, like kind of going on that journey to like think about like getting pregnant with her and whatnot, is when I truly learned the lesson of presence. Before then, I think I was so busy and focused on like building the business that I kind of rushed through their childhoods, unfortunately. But I think like that was what the universe wanted to show me, and the universe kind of gave me Jayla in a way that let me kind of get a do-over for that age range. When Kano was born, I opened the business 3 weeks later, or 2 weeks later, really. And I have a big blur spot, you know, because you're in the chaos of postpartum, but I was in the chaos of also starting this business and trying to create an income here, because Dylan had been like, you know, we're going to move back to Wisconsin if you don't start this business. So, you know, we can't afford to live here with 2 children and yada, yada, yada. So I was like, okay, I think, you know, I had to pull the trigger, and so grateful for that ultimatum, if you will. But pulled the trigger and opened the business. But Kano was only 2 weeks when I like was like, okay, build a website, learn how to do this. Like, so I was all messed up, right? Like, you're 2 weeks postpartum. I had a 2-year-old. Chloe was 2 not even 2. She was 23 months when Kano was born. And so it was 2 under 2. And that is a total blur period for me. And it's sad a little bit, but it's also a huge gift, because I learned the gift of presence probably by year 3 or 4 in the business. And I think that's the gift. And there's a book by Ram Dass, and it's called Be Here Now. And that book literally awoke in me. And it's a really crazy book. Like, he was on drugs when he made this book or something. But like, it's written in like circular patterns, and you have to like follow it. But the mantra of be here now can just be repeated in your brain when you're with your children, when you're during your workout and you don't want to be there. And it's like, nope, just be here now. Be here now. Be here now. And like, I constantly repeat that to myself. Block out everything you think you need to do in the business, everything you think you need to do at home. And it's like, just be here now. And so the children gave me that gift. Different self-help books and things I read have given me that gift. But yeah.
I love that. And so you told us the mantra that kind of gets you through, but like, there have to be times when shit has hit the fan, the positive outlook is gone. Like, how do you pull yourself out of it? Like, what are your tactical things? Because we hear it all the time. Like, how does she do it? She runs this business. She runs this second business. She works out. She has 3 kids. Like, there's all of these things. But, like, I couldn't do it. I have a cat and I'm stressed out. So, like, what do you do? What's the secret?
No. So, I don't have an answer. That's just who I am. I think I've also trained myself to be that way. It truly is not just an outlook. Like, it is an outlook. It's a mindset that I choose to have every single day. And part of that mindset is like, am I living my billionaire life? Like, truly, is this the life that I would be living as a billionaire? Every single day, what would I choose? And hands down, this is it. Every single time. And if something feels out of alignment, then we have to make a shift. Like, I have to make a shift, and that's not going to, support this lifestyle that I'm aiming for and the lifestyle that I want, right? So then that's where things need to shift. And when things blow up into chaos, it's like always and forever. For me, it's what's the lesson here? If we have some business problem or whatever, it's like, what are we learning here? What's the gift? Someone left the team. What are the lessons we learned? Oh, this actually goes back to the recruiting. This is how that person came into the business. Oh, okay. Maybe we need to be more aware of that next time. Maybe we should ask more questions around that. And so it's like, it's just everything is here, I think, to give us lessons. And it's like, you wouldn't choose. Someone said this to me, you know, in my thralls of endless counseling and shamans and healers, who I learn from. And I just get to learn about myself, about my soul, about life. So that lights me up. Like, that's so fun for me, like, to continue to progress on those realms. And someone said to me, it's like, you did.
Oh, what did I say?
I think you said, you were like, would I just come, if I had the chance to come to Earth and only feel the good,
oh, yeah.
would I come to Earth just to feel the good? And you're like, you wouldn't know the fucking good if you didn't have the bad. And there really isn't any good or bad. They're all just lessons. And like, and that's truly how I look at this. My outlook is 100% always that this is a playground and I'm just playing the damn great game. Like, this is Earth. Welcome to Earth. Your soul gets to play right now and then continue to evolve and learn these amazing lessons. How are you going to progress through them? And the worst shit could happen. And it's like, okay, but you've already, like, you could lose it all. Someone asked me the other week on Justin's call when I was doing a coaching call. It's like, but do you work on, like, manifesting not losing it? And it's like, no. Because I have all the skills in the world to go rebuild this. Mm-hmm. So that gives me all the confidence in the world that I can just go repeat this. Yeah. And, like, I get to, every single thing is a lesson. And a valuable one. And so everything you think you're going through that's hard, that's chaotic, that's not ideal. Okay, what is it teaching you? Like, that is a gift. So then you have gratitude for the lesson, for the not ideal, and more good stuff just keeps coming, right? And so, yeah, I don't have a good answer for, like, how I do it all.
Okay, well, that was a great answer.
But that's the, you know, at the end of the day, it comes down to your mindset. It's just what are you going to see this world as? Mm-hmm. And how do you want your container to be? How do you want your soul container to be and show up? And you choose.
Truly. Love that. We're going to close out on this question. What are you most proud of? Because I know you, so I know the mindset is like, I can always do better, I can always be better. But, like, when was a moment when you're like, damn, like, I did that?
Well, I had a little bit of that when we were on, I had Devyn come with me on this coaching call that we did for, like, a couple hundred people last week. And it was kind of like, I was like, Devyn, how big's our team? You were like, 13. And I'm like, okay. And I was like, I'm sitting here teaching other health professionals that are top level at their game, helping them, like, learn how to run their businesses and build their businesses so they can help more people. And I was just like, I think I said out loud, I was like, I actually don't know how I did this. And it was kind of one of those moments, it's like, oh my goodness, like, this business runs without me, really. I mean, we do content creation, but I'm just playing. Like, I didn't actually feel like I worked today. Like, we just did a photo shoot and we're playing, right? Like, and I get to hang out with my best friend who also is my kick-ass GM. And so it's like, for me, yeah, there's just, what was the original question?
What are you most proud of?
What am I most proud of? I guess it's that. I mean, it's fun that, like, we built a business. There's stuff I'm not ready to say that I can tell you that I'm most proud of soon. But it's the fact that I built this while my kids were growing up and not born, and, you know, I've been able to do it all, and obviously not well. Like, there's holes everywhere. And you just continue to make better decisions and choices along the way to help fill those holes and help improve your life and become more elevated and fucking aligned and elevated, whatever, you know? And so, yeah, so I guess I'm really proud of the business that we've built. Not even me, we have built, you know, we've done this together, and you've helped me, and so our team has helped, and so it's just a pretty magical thing to think that. And I guess I'm very proud of the life I've built because I get to choose what I want to do and work on every single day, and my babies are thriving, so I'm proud of them. Yeah, I'm really proud. I'm proud of the books that I've written. I think that, you know, people before we released pregnancy era, before we even really had our pregnancy, when we had our pregnancy protocols, really since the beginning of the get-go, but like people were not treating until we normalized treating internally during pregnancy to help people have better births. People were not doing it. They didn't talk about it. They tabooed it in every single pelvic floor class. So when we came out and like I really put myself on the line, I think for that, I was really proud of that because it's like now that's normalized. And of course now the reason people will get referred here is because like their OBs have seen our birth outcomes.
Yeah.
Like when an OB finds out that their person delivering their patient came to Body Motion, they're like, oh, okay, like this will be easy, you know? And like when someone's doula is like, oh, you go to Body Motion, yes, I want to be your doula. Like of course they do because it's easier deliveries. Like, and so I don't mean to like not brush my shoulders up, but like truly like that makes me really proud.
Yeah.
So when doctors see your outcomes, even when it ends in C-section, and they're like, oh, the C-section was so much better because they did that pelvic floor work for you, with you. And it's like, they don't say that about other, pelvic floor therapy. And of course some people are starting to treat like us now because they, I think it's getting out there more so. But we're the ones that kind of pioneered that, it feels like.
Not so much me, mostly Allison. But we do see it in the text messages too.
Right.
Like people are like, my nurses were like astounded. Like, how did this happen? And it's just, it's so amazing.
And so that goes to show you why so many of our patients are nurses here. There's so many OB nurses.
Truly.
Because they'll come from everywhere. They'll come from the east side, they'll come from the south end, they'll come from the north, because they work at Evergreen, they work at Overlake, they work at Virginia Mason, or did work at Virginia Mason, they work at Valley, like they work at Providence. And so then they'll come here. We've had nurses, multiple nurses, cohorts of nurses from every hospital because they're like, no, I saw your client. She was a first-time mom. She had this huge baby, and she delivered the baby with like 2 breaths.
I know exactly what you're talking about.
Yeah, I mean, it's like, but that's like every nurse that comes here. And like, you want to know why we have such a big population of nurses. It's because they see our birth outcomes. And like, they're hand and foot in these deliveries. Why are these deliveries so much easier? Hours in the labor, so much easier hours in pushing, right? I'd rather hold someone's leg for 10 breaths than for 10 hours of pushing. That's not productive, right? And so, anyways, tangent. I'm proud of that.
Yeah. And I feel like we sit around a lot like, wow, can you believe this?
Yeah.
Like, at least once a week we're like, who gave us this much responsibility?
Yeah.
But it's such a blessing. Well, this has been so fun. I love being a host. I got my like, tiny little mic. But we will drop the links to both of her books as well as the Ram Dass book, Be Here Now, in case you need some inspiration. But that's all I've got.
Love it. Thank you so much. This was
Of
a
course.
blast.
It was so fun.